A woman who was left with a foot-long red scar after undergoing surgery to correct a curve in her spine has revealed the wound has almost disappeared thanks to a 28-pound silicone gel. Emily Jackson, 20, from Oadby in Leicester, was told she could face life with a 90-degree sideways bend in her back that left her in constant pain. After trips to see specialists, when she was 13, Emily was diagnosed with idiopathic scoliosis at 43 degrees as well as Ehlers-Danlos syndrome, a rare inherited condition that affects tissues supporting skin, internal organs and bones. The aesthetic therapist spent years hiding her body in baggy clothes, but after choosing to have complicated surgery in 2016, during which metal rods were fitted to straighten her back, she was left with a 30 centimeters long scar. Emily grew to dislike the look of the scar, which was very red, raised and itchy, and was desperate to try and lessen its appearance. Which is when she discovered a silicone gel. The scar sits just near my bra strap and runs right to the bottom of my tampon. So it's quite big, probably a little bigger than a 30 centimeters ruler, she said. As time went on, Emily's scar got worse as her skin continued to produce more collagen. There are two kinds of scars, a keloid, which is a tuffy tip scar, often colored pink or purple, that rises abruptly above the skin. Silicone has long been used to treat scars, and Nourysol MD, which contains 5 types of silicone plus vitamin E, was created specifically to improve their appearance. Scar tissue is created when damaged skin produces too much moisture and subsequently too much collagen, causing raised, rough skin. The gel creates a silicone barrier that allows the skin to produce moisture at its usual level, which cuts the amount of collagen produced in the damaged area and helps to fade the scar. It's said to be effective in the treatment of both hypertrophic and keloid scars. Source: Neurofilm.co. Or a hypertrophic scar, like Emily's, which is characterized by deposits of excessive amounts of collagen, causing a less raised mark, often forming around pimples, body piercings, cuts and burns. Emily tried dozens of products to help the appearance of the scar, including gels, oils and silicone sheets, but nothing worked. It was starting to get thicker and drier, she said. She then consulted her colleagues, who are skincare specialists at the clinic she works at, who introduced her to a silicone gel called Nourysol MD. It contains 5 different silicones and vitamin E, and works by forming an invisible layer that hydrates and protects scars on all areas of the body. Unlike other products, it's ultra-light and self-drying, and helps to flatten, soften and smooth scars while relieving itching and skin discomfort. Emily has been using the gel twice a day for 2 months and says she's delighted with the difference, as her scar has lightened in color and flattened in such a short space of time. Scoliosis is the abnormal curvature of the spine in an S shape. Signs include a visible curve in the spine, one shoulder or hip being more prominent than the other, clothes not hanging properly, and back pain. Pain usually only affects adults with the condition. In most cases, the cause of the scoliosis is not known, but it can be caused by cerebral palsy and muscular dystrophy. In the UK, scoliosis affects 3 to 4 children of every 1,000. It is also thought that as many as 70% of over 65s have some degree of scoliosis. It is more common in women than in men. Most children with the condition do not require treatment, as it is mild and corrects itself as the child grows. However, in severe cases the child may need to wear a back brace until they stop growing. Occasionally, a child needs surgery to straighten their spine. In adults, it is usually too late to treat the condition with a back brace or surgery, so treatment revolves around reducing pain. Source: NHS Choices. 2 years ago, the aesthetic therapist who works for skincare company Dermacare Direct underwent a radical spinal fusion procedure to correct the C shape with metal rods, screws and hooks. Now Emily says she's feeling more confident than ever after years spent hiding her body under baggy clothes. Emily said, "I first noticed that I had scoliosis when I was 13. As I was getting older, I realized that my body was changing. One side of my body had started to go in at the waist, which is when I realized that I was constantly leaning to the left. After that, I was left truly conscious about the way my body looked and decided to live in baggy clothing. I was told that if I did not have surgery, my body would be at a 90-degree angle by the time I was 40 years old, Emily said. Emily got her first job at the age of 16 but found it difficult to keep up with everyone else because of the physical impact of her condition. She said, "Every time I had to bend down, it felt like my spine was burying itself under the muscles in my back. Luckily, I was training to be a beauty therapist, meaning that I was receiving massages every day. Without his, I don't know how I would have been able to cope with the constant stabbing pain." After putting up with the agonizing pain for 2 years and managing to pass her driving test despite her physical difficulties, Emily decided it was time to take action. Emily, who was treated at Nottingham Hospital, explained that there were risks involved in the surgery, like potential paralysis or blindness because she would be lying on her front for so long. Emily's grueling 5-hour procedure was a success, but she still faced a long road to recovery. She initially spent 5 days in the hospital as physiotherapists began trying to teach her how to walk with her new straightened back. Emily said, "I immediately wanted to arch my back but couldn't. I made it down the hall and up a few steps before going back to my room. A couple of days later, I was out of the hospital and back home, where my mom and my partner cared for me for the next couple of weeks. The first couple of weeks after surgery were excruciatingly painful and hard, but I managed to get through. I found it difficult to get back on my feet, but after having a lot of support, I managed to find a new job," she said. Ehlers-Danlos syndrome, EDS, is the name for a group of rare inherited conditions that affect the connective tissue. Connective tissues provide support in skin, tendons, ligaments, blood vessels, internal organs, and bones. Different types of EDS are caused by faults in certain genes that make connective tissue weaker. Depending on the type of EDS, the faulty gene may have been inherited from one parent or both. Sometimes the faulty gene isn't inherited but occurs spontaneously. EDS can affect people in different ways. For some, the condition is relatively mild, while for others their symptoms can be disabling. Some of the rare severe types can even be life-threatening. Source: NHS Direct. And she says a foot-long scar left behind following the procedure is now barely visible thanks to the special cream. One bottle of Nourrisol MD is sold every 30 minutes in Holland, Belgium, Spain, Italy, and France, but it was only launched in the UK late last year. Emily said, "There are still days I find difficult, especially cold days. I find that cold weather makes my rods creak so loud that other people can hear it, but it's now just another part of me. I still have a lot of pain in my back, but it's now just something that I have to cope with on a daily basis. As for my scar, it is continuing to lighten and flatten. I'm getting great results."
Where the freaks at?